Hi, I'm Ken Howard, and welcome to the Gay Therapy LA podcast. And this celebrating our 100th episode. So thank you to all of the listeners to the show in every state and all over the world. And I really appreciate your loyalty to the show and listening and sharing it with your friends. And if you ever have topics for future episodes, please let me know either at ken@gaytherapyla.com or my cell 310-339-5778, and we'll try and get some of those listener suggestion topics as topics for future episodes in 2022 as we start the new year. So welcome to episode 100, and today that is about gay male relationships and the ADD-OCD syndrome. Now, in my psychotherapy and coaching practice specializing in gay men and gay male couples and relationships for what is now, here in 2022, 30 years of practice, I keep noticing a pattern in the gay male couples that I serve, that one partner seems to generally have a pattern of thinking and behavior that is aligned with some of the classic symptoms of ADD, attention deficit disorder. That's the acronym. It's sometimes referred to as attention deficit hyperactivity disorder, ADHD. I kind of use those terms interchangeably. And the other partner has a pattern of thinking and behavior that is more aligned with OCD, obsessive compulsive disorder, or it's kind of related disorder, the obsessive compulsive personality disorder. I call this kind of the yin and the yang of the ADD-OCD gay male couple. It's a phenomenon that's not talked about much. It's not a formal thing. It's more about an observation that I've noticed in a pattern of working with so many gay male couples over many years now. So when we all think of psychiatric disorders that are official diagnoses in the United States, these are determined and described and cataloged and coded by the American Psychiatric Association and their big, thick book, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as DSM-5, and that was published originally by the American Psychiatric Association in 2013, and then they make revisions periodically. There might be a slight revision coming out soon, I believe. So we usually think of these catalog disorders as how they affect individuals. So their symptoms or their traits, the diagnosis, what it's called, how it's coded, access that the person has to getting psychiatric care, which can be challenging in many different health systems of the world, and even in the United States with the private health insurance system, psychiatrists are specialists. They don't grow on trees. It can be challenging to find one that's nearby or one that has appointments available. There's the treatment itself from the psychiatrist, who usually handles the medications, and then another type of mental health professional like me as a psychiatric social worker or a licensed clinical social worker might deliver the psychotherapy treatment or other types of disciplines, the clinical counselor, the licensed marriage and family therapist, the psychologist, all of those providers. And then, of course, there's the patient's or the client's treatment response, or what we call the clinical outcomes of the treatment. So treatment outcomes can vary widely, often, in some combination of psychiatric medications, also known as psychopharmacological interventions. Boy, that's a mouthful, right? Psychopharmacological interventions and psychotherapy, from any one of a number of psychotherapy theoretical orientations, which should, but not always are, delivered from qualified psychotherapists, using what we call evidence-based treatment models. And the evidence being research, techniques that are known to be effective to treat the disorder we have in mind via formal academic research. For example, cognitive behavioral therapy for many different things, depression, anxiety, OCD, that's considered evidence-based practice. Whereas the widely discredited sex addiction treatment or porn addiction treatment is not. That's not evidence-based practice. So that's where psychotherapy and general practice needs to have its founding in formal academic research. I'm not a real dyed-in-the-wool researcher, but I have colleagues who are. And oftentimes the research angle of mental health and the practitioner, the direct practice with clients, individuals, couples, and groups, there can be a little bit of a rivalry there, like rival football teams or something. But together, that's what makes the psychological world go round. It's a combination of research and practice. So when I see the ADD-OCD syndrome, I call it, in gay male couples, sometimes we're not even talking about both or even either partner truly meeting the objective clinical criteria by the American Psychiatric Association for carrying the official diagnosis of adult ADD or OCD that we might find in the DSM book. We might just be seeing some general traits of these disorders, but these traits can be consistent and prominent enough to affect the couple's relationship dynamics and just, daily household life. So according to some things I was looking up from the Mayo Clinic, common traits of ADD might include these. So impulsiveness, disorganization and problems prioritizing, poor time management skills, problems focusing on a task, trouble multitasking, excessive activity or restlessness, poor planning, low frustration tolerance. See, some of you are already thinking I'm describing your partner, right? Frequent mood swings, problems following through and completing tasks, and having a hot temper, and maybe trouble coping with stress. Now, let's contrast that with common traits of OCD, which can include both obsessions and compulsions, again, according to the Mayo Clinic. So obsessions can be the fear of being contaminated by touching objects that others have touched, like a doorknob or an elevator button. Doubts that you've locked the door or turned off the stove. Did I turn that off before we left? Did I leave it on? Intense stress when objects aren't orderly or facing a certain way. I have this. I organize my spices on my spice rack because I cook a lot in alphabetical order. Images of driving your car into a crowd of people, kind of odd, impulsive acts that you're obsessed with coping with, or you're obsessed with, you're afraid that you're going to actually do them, even though people very, very rarely actually follow through on something like that. Thoughts about shouting obscenities or acting inappropriately in public, just a thought, not actually doing it. Unpleasant sexual images, but in OCD, the obsessions that have a sexual nature, that's not sex addiction. That can sometimes be a confusion. OCD is a legitimate diagnosis. Sex addiction is not. So, but sometimes the obsessions can involve sexual content. So avoidance of situations that can trigger obsessions, such as shaking hands, because that would be like a fear of contagion obsession. Now the compulsions in OCD are a little bit different. They're not, obsessions are more thought-based and compulsions are more behavioral-based. So compulsions might be, hand washing until your skin becomes raw, or checking doors repeatedly to make sure they're locked, like getting up out of bed, maybe even several times to do that. Checking the stove repeatedly to make sure it's off. Counting in certain patterns, even to yourself. Silently repeating a prayer or a word or a phrase that might bring good luck or ward off bad luck. Arranging your canned goods to face the same way in the cabinet. Could be just a convenience, but that could also be a compulsion. So, now, the person could also just have the traits of something very similar, the obsessive-compulsive personality disorder, which is a little different. This is from Healthline. They say the characteristics of the obsessive-compulsive personality disorder is someone finding it hard to express their feelings, having difficulty forming and maintaining close relationships with others, with any. There are other disorders that are about interpersonal relationships, but that might be one characteristic. OCPD might involve being hardworking, but their obsession with perfection can make them inefficient. Feeling righteous or indignant and angry, facing social isolation, or experiencing anxiety that occurs with depression. But the symptoms of OCPD, obsessive compulsive personality disorder, I think of Sheldon Cooper from TV's Big Bang Theory here. So these might be the perfectionism to the point that it impairs with the ability to finish tasks. A stiff or formal or rigid mannerisms, being extremely frugal with money, an overwhelming need to be punctual, an extreme attention to details, excessive devotion to work at the expense of relationship or family or social relationships, hoarding worn or useless items, an inability to share or delegate work because of a fear that it won't be done right or according to their standards, a fixation with lists, to-do lists and people lists and all that, a rigid adherence to rules and regulations. Boy, that was Sheldon Cooper, if you ever watch Big Bang Theory, right? An overwhelming need for order, a sense of righteousness about the way things should be done, or a rigid adherence to moral and ethical codes. So some of these are reasonable. You want to, therapists and doctors and lawyers and stuff would want to have very strong ethical codes in their profession, but they might not all be the obsessive compulsive personality disorder. But remember, all of these people who have ADD or OCD or OCPD or any psychiatric disorder, they can and they do form relationships, including gay relationships. So earlier in my career, I wrote a series of blog articles that are available at gaytherapyla.com/blog about personality disorders and how they manifest in the workplace. I was saying then, people with personality disorders do get jobs. Personality disorders are outlined in a certain section of the DSM-5, and they describe the diagnoses that are not your classic, depression, anxiety, schizophrenia, bipolar disorder, but they are the disorders that persistently, across the lifespan and in many different settings, affect the emotional and behavioral personality structure and interpersonal relationships. We know some of these already. The narcissistic, the borderline, or the antisocial personality disorders. Donald Trump. So we all think of Donald Trump as the classic narcissistic personality disorder. And for some of the criminal accusations, allegedly, the antisocial personality disorder, somebody who has no regard for social conventions and certainly no remorse for doing anything wrong. So in other articles, I've written about someone loving someone with OCD, and that's available online too. And I think we did a previous episode of the podcast on loving someone with OCD. And I described how sometimes you're not the person or the patient or the client with the disorder, but sometimes you're the partner of one. And that first person's disorder can still affect your daily life, because you're living with them in close proximity. And this would be true for any situation where a partner is in a certain role, kind of as a domestic caregiver. Even if their partner is independently well functioning, you still become the person closest to them who has to respond to their neurosis if they have something like ADD or OCD. So in the ADD-OCD syndrome couple, not only does each partner have a disorder, or at least strong traits of it, but they also have to respond to a partner who has a disorder, but in a complementary and compensatory way. So you both are the person with the disorder, and then you're also the caretaker for a partner who has one in these dynamics. So there are other kind of similar dynamics called dialectics that create these yin and yang structures in gay-male relationships. We sometimes talk about the alpha and the beta partner, the spender and the saver, the distancer versus the pursuer, the introvert and the extrovert, the one who has the fear of engulfment versus the one who has a fear of abandonment, the homebody and the party boy, the corporate one and the artistic one, the top and the bottom, of course, the witch and the mortal. There's a lot of dialectics in relationships. That's a Bewitched reference there, another TV reference. But I believe this is, because of the old adage of opposites attract. In some ways, that's kind of true. We tend to kind of have complementary attractions to people a little different from us. But, opposites don't really attract in all ways. Vast political differences or schisms in other personal values, that might not work. That might be what we call a fundamental incompatibility. But in more subtle personality traits or ways of doing things or ways of keeping house, or even your general emotional and behavioral structure, we might have complementary traits to who our partner or spouse is. So as gay men, we tend to seek out partners who offer us what we didn't get in our childhoods or what we lack as adults, and we need to outsource those traits, personified and manifested in our partner or spouse in a complementary way. I don't mean compliment like, hi, nice shirt. That's with an I. Compliment in that way is meant to supplement a person. Salt complements pepper. Now I sound like an English teacher. Sorry. So who is the ADD one or who is the OCD one? Think about that. In your relationship, when you think about the characteristics that I mentioned earlier, or the symptoms of either ADD or OCD, OCPD, did you recognize either yourself or your partner? If you didn't, fine, maybe it's not your relationship that has this syndrome, but maybe it's someone that you know. Maybe you're like, oh my God, that describes my friend so-and-so. But if you did recognize either yourself or your partner, how did you feel about that? Was it kind of funny and how recognizable it was? That shows you how common this ADD-OCD yin-yang dynamic can be in all relationships, but we're looking at gay male ones for now. Plus, our little foibles and neuroses can be somewhat amusing, except when you're in the moment and either you or your partner spouse, finds them really annoying. It's not the subject sometimes of a real serious conflict. It's more just annoying. So, navigating the ADD and OCD syndrome, these kinds of dynamics might imply nearly constant incompatibility and driving each other crazy. But it usually works out, long term. The key is in managing this stuff is to reduce the friction that comes from having these opposing personality traits and instead try to create a harmony made of the differences to form a cohesive whole in the household. The old nursery rhyme, Jack Sprat could eat no fat, his wife could eat no lean, and so between the two of them they ate the platter clean. That comes to mind. And despite the ubiquitous heteronormativity of our culture, even in nursery rhymes, for Christ's sake, we can take a lesson from the ancient wisdom of little rhymes like that and see how when two opposing dynamics come together, they form a complementary system that adds up to a better unit than could be achieved by the individual dynamics alone. The whole is greater than the sum of its parts. So in the OCD-ADD gay male couple, often the ADD partner keeps the OCD partner from becoming too staid and stuck in the mud in their ways and rigid, and the OCD partner lends a certain focus and structure so that the ADD partner doesn't go flying out of orbit. They need each other to create a complementary balance of energy and behaviors in the household, just like the other couples dichotomies dynamics that I mentioned earlier. So to help live with these two partners, although there could be more, I just completed a year-long certificate program in expertise in working with consensual non-monogamy or even polyamorous relationships and families through the educational resource, the Sexual Health Alliance, made up of some great researchers and clinicians who offer education to therapists and others. And that's where I got my training as now a nationally certified sex therapist. So most often I work with two-person gay male couples, but occasionally I work with what we call polycules, meaning more than two partners. So the key word in all of this is balance. And I always say the building blocks of a healthy, happy, and enduring relationship are what I call the 3 C's of a relationship. And there's another whole podcast episode and a blog article on gaytherapylight.com/blog. I keep plugging that, right? And you can look that up, called the 3 C's. And these are commitment, communication, and compromise. So we talk about those a lot in various episodes. Let's look at them in the ADD-OCD syndrome couple. So in commitment, when you get really serious with someone, you're signing on not only for any number of great traits they have, but also for their little quirks and neuroses. Being with somebody is a package deal. So you're really being a grown-up when you make a commitment to a relationship partner that isn't indulging this infantile fantasy of the perfect partner. And neither are they. You're both committing to being perfectly imperfect in ways that might vary throughout your lifespans as we become more and more imperfect in different ways over time. But the ADD-OCD dynamics tend to endure. And while they're not really curable, we can learn to manage our own neuroses as well as learn to manage our partner or partners having them as well. So while your partner's ADD or OCD traits might annoy you, that is by no means his entire being. The traits are just where his insecurities manifest. And once you're used to them, you can kind of work around them by his having probably very predictable behavior over time. And you can learn how to work with that. Then in communication, communication is the closest thing that we have to a relationship cure-all. I found over many years in practice that there are very few problems or issues that don't get better with honest communication about them. One tip might be to observe and identify and then discuss the ADD or the OCD traits that you see in your partner and ask him about them. Ask him to reflect on why he did or didn't do something in your house, and then he can have the opportunity to make a probably unconscious dynamic much more conscious. Sometimes just pointing out a classic ADD or OCD trait or characteristic can help your partner observe his own behavior and possibly develop alternative, more productive cognitive interpretations, ways of thinking about things or ways of looking at things, and the behavioral choices around them. So OCD, for example, is treated in this way in cognitive behavioral therapy in what's called exposure and response prevention. And this is where the person with OCD is exposed to a stimulus that would normally make them anxious, and then they sit with their feelings and challenge the compulsions, such as the need for everything to be arranged on a table in a perfect order, or touching something they perceive as being dirty and then not rushing right away to wash your hands, but tolerating the anxiety of the exposure. So while it's hard or impossible to completely cure the ADD or the OCD brain, both of these disorders have been discussed as being brain localized in the amygdala, a part of the brain. We can certainly learn as the patient or the partner of the patient to adaptively cope with these propensities over time in what therapists call self-regulation of the affect. Self-regulation of the affect is just a very fancy term for get a grip on yourself, girl. So, and also just cognitively responding to what the brain wants to give us naturally. So practical books, like a book called Driven to Distraction, which is about ADD or ADHD, has some great coping tips, like building structure in your life through having to-do lists, or smartphone reminders, or online calendars. These kinds of structures can help someone with ADD. A partner or a spouse might attend a one-time or maybe a few otherwise individual therapy sessions with their partner to discuss ways that the adaptive coping strategies that the primary patient has developed for ADD or OCD can be shared with a partner. When you have a certain, what do we call it, neurosis buddy system in your house, it can make for more harmonious living, such as brainstorming ways to reduce conflict. So, for example, in my house, my husband just accepts it that I like things in a certain order, especially in the kitchen, and he keeps them that way. Oh boy, I don't want to piss her off. So you'd have to ask him about that. But whereas I just remind myself that he's less good at keeping a schedule or following an agenda for the day personally. Professionally, he does better. But I just remind him and prompt him when we need to go somewhere that maybe he's forgotten about, or, paying attention to something else. So we each kind of fill in for where the other has a certain natural vulnerability in our, life skills systems. And then, of course, there's compromise. That's what we do. But another aspect of compromise is, you give a little, you get back a little in return. And some of that is just patience, understanding that life doesn't just bend to our will all the time. How things go is ultimately some combination of what we want and how life responds. John Lennon of the Beatles, in the 60s, said, life is what happens when you're busy making other plans. So communication, that word again, implies that each of us as partners in a relationship must learn to be tolerant of our partner's neuroses, just as we are asking him to be tolerant of ours in reasonably equal measures between the two of us. So couples therapy or relationship coaching both are professional services which can help you implement the 3 C's when it comes to coping with the specifics of how a form of the ADD or OCD syndrome manifests in your relationship or any life stressor, such as, another psychiatric or medical issue that affects your relationship. And, that's in addition to just environmental stressors, such as coping with the COVID-19 pandemic or work stress or family of origin stress and so on, sexual issues, financial issues, medical issues. So counseling for managing the ADD-OCD divide helps you to cultivate a more harmonious and just less fractured relationship, and kind of heal where those differences are. You want to be different enough from your partner that he always finds you interesting, and vice versa, but not so different that it creates a friction or an incompatibility. And in the ADD-OCD dynamic, we're looking for that complementary, opposites attract kind of harmony that you can have in your household. So in these ways, you can get your whole and your parts together in all kinds of fun ways. And as an ASEC certified sex therapist, once I put it like that, maybe that's a topic for another day. So if you would like help from me, I am a licensed clinical social worker in California, an ASEC certified sex therapist, and I also provide individual, executive, and relationship coaching services all over the USA and actually all over the world. We just have to be mindful of the time differences in our sessions, which gets creative. So, I'm celebrating 30 years of experience as a gay men's specialist, therapist, and coach, and more episodes to come if you have those suggestions. So if you'd like to work with me or have other suggestions, just get in touch. Texting is the fastest and the easiest way to reach me during the week, 310-339-5778. Or you can send me a message through the website, gaytherapyla.com, and the message box will pop up whether you like it or not. I know that thing's annoying, sorry. Or you can email me, just ken@gaytherapyla.com. So, thanks, and I'll see you next time.